So welcome to the first ever Connecticut Liver Health Day educational luncheon. I would want to extend a very warm welcome on behalf of myself and my co-director, Dr. Wajahat Mehal. It is truly very inspiring to see colleagues from all across different specialties, public health specialists, community organizers, and policy come together with a shared commitment to improving liver health across Connecticut. Let's give ourselves a round of applause. So a bit about myself. I joined Yale about 6 years ago as an assistant professor in digestive diseases after completion of my fellowship in transplant hepatology in Virginia. My hepatology clinical and research practice are primarily in the field of steatotic liver disease, from asymptomatic disease all the way through end-stage liver disease. I also serve in a few leadership positions in the section, as well as with the Yale Liver Center. In addition, I'm involved in some nonprofit organizations as well in trying to move forward liver health. And in terms of my non-academic and non-professional roles, I'm a wife and a mother with 3 beautiful children, and I'm very honored to have my husband, Victor, and my daughter here to support as well. So why does this event matter? This is because liver disease often develops silently, yet affects a growing number of individuals across our state, the nation, and worldwide. Most liver diseases are recognized at the late stage when, unfortunately, options for treatment and disease reversal are very limited. Thus, awareness and early detection through coordinated interdisciplinary action, such as the one we are hoping to foster today, are key to ultimately improving liver health outcomes. Another reason why this matters is because there are silos within liver disease care which impede dissemination of information, cross-disciplinary collaboration, cross-institutional collaboration, and ultimately patient care. So this event was established in 2025 through legislature in Connecticut, following recommendations from the Connecticut State Working Group on Steatotic Liver Disease, which I was honored to co-chair along with my colleague, Dr. Wajahat Mehal. And the initiative reflects a growing recognition that liver disease is a significant and evolving public health challenge. This luncheon is part of that broader coordinated effort to bring together various individuals to move forward liver disease care in our state. I have been amazed and very excited to have multidisciplinary collaboration from all across different institutions in Connecticut. And I list here the different institutions and initiatives that have happened over the past few weeks in connection with Connecticut Liver Health Day. This started at the West Haven VA Medical Center, where they held informational sessions on liver disease on the first, second, and third Wednesday of this month. At St. Mary's Hospital at Trinity Health Waterbury Hospital, they held several events during their Liver Week between April 13th and 17th. At Southern Connecticut State University, there was awareness and dissemination about this very event through some posters displayed a few days ago. At the University of Connecticut, there was an open house held on Friday, and you're going to see some pictures from that in the next slide. At our Yale New Haven Hospital, my very own institution, we had a wonderful community day yesterday. And at Hartford Healthcare, there's going to be events next week. So here are some pictures. The very first one at the top left corner is from the VA Medical Center, and the rest are from St. Mary's Hospital Trinity Health. Here you see the posters being displayed and awareness at Southern State Connecticut University. And the other pictures are from University of Connecticut through the event they held last Friday. And then you see events from our Community Engagement Day yesterday at Yale New Haven Hospital in North Haven. So I'd like to take this opportunity to introduce my co-director, Dr. Mehal. He's a professor of medicine and director of the Yale Fatty Liver Disease Program and medical director of the Yale Center for Weight Loss. He develops guidelines for the management of MASH and obesity and also develops educational programs for outreach and trainees. He's an NIH-funded researcher and earned his medical education and PhD at the University of Oxford in England with postgraduate training at Yale. So just a brief overview of today's events. We have a series of podium talks in the beginning. There's going to be a break and resource fair, and our resource fair is going to be held on the left side, to my left. And please, stop by and hear about the various resources that you can take advantage of in caring for your patients. And then we'll gather back in here for a wonderful panel session that will be followed right after by roundtable discussions, which will be held at the tables where you are. We have host hepatologists that are going to be strategically placed on each table to help facilitate that discussion. And then we'll close with remarks and opportunity to network and visit the resource fair after that. So I'd like to show here disclosures for all our different speakers and facilitators, showing the different opportunities or activities that they hold in addition to their academic roles. Lastly, I want to thank our sponsors for making this event possible. This was made by an educational grant from Madrigal Pharmaceuticals, exhibit support, for which we have 3 lead sponsors from Boehringer Ingelheim, Madrigal Pharmaceuticals, and Novo Nordisk. Our silver supporter is Genentech. And then, of course, I want to acknowledge the support of our host institutions as well, Yale School of Medicine and Liver and Health Innovation Consortium. Enjoy the event, and please, we'll ask you for feedback at the end. Thank you very much.
Thank you. So, welcome. We're just at the beginning of the sessions, of course. And the structure we've laid out is that the formal presentations are relatively brief, and there's a lot of time in the afternoon for everybody to discuss. The first thing I'd like to say is actually thank you all for taking time on a Sunday away from your family and other activities. That's not trivial, so thank you for doing that. There are lots of advantages to this. I've actually met colleagues that I've been working with for over a year, like closely working with, but met them for the first time. And these are colleagues at my own institution. So that's a huge bonus from an event like this, and I would really encourage all of you, because I'm sure many of you have things in common and have not met each other. So I'd really encourage you to use this event, particularly the afternoon, which is open forum, to really have conversations and discuss things, because you will have a huge amount in common. The third thing I would just like to point out is that although I'm sure I'll enjoy this event for social reasons, but the reason for it, unfortunately, is unfortunately serious, which is that the trajectory for liver health is worsening, as you'll see from data that will be shared with you shortly. So I will enjoy this tremendously. I'd be happy to have this as a social event, but underlying this, unfortunately, are some very serious trajectories for our patients, which really means that we need to have an event like this where people across from leaders in the Senate, leaders in public health, clinicians, researchers really need to come together. So I'll stop my